Well, welcome everybody. We're very pleased to have you here this afternoon for this very significant announcement about research at Marshall University and a very important collaboration for the region. I'm John Marr. I'm the Vice President for Research for Marshall University, and it's my pleasure to welcome you here. First, I'd like to acknowledge a few groups of folks and individuals. First, the members of the Board of Governors of Marshall University who have just concluded their meeting. The members of the Marshall University Research Corporation Board of Directors who are here with us. Brian Nolan, the Chancellor of the West Virginia Higher Education Policy Commission, thank you for coming. Paul Hill, his Vice Chancellor for Science and Research. And representing the Governor's Office, Martha Walker, the Director of the Governor's Office of Health Enhancement and Lifestyle Planning, thank you for coming. And we'd like to offer our special thanks to Governor Tomlin for his support of biomedical research in West Virginia and his commitment to health care. There's been a lot of mystery associated with this award. We hope it's been worth your trip, but we're very proud of this, and we want to let you know, or I want to let you know, that events such as this are not possible without vision, dedication, and hard work, and two of the architects of this vision are going to talk to us here today. First among them to actually make the announcement is President Steve Kopp of Marshall University.
Thank you, John. And thank you all for joining us here today. On behalf of Marshall University, Martha, welcome. It's great to have you here. Brian, Paul, great to have you here as well. Today, on behalf of this great university, I'm very proud to announce a grant award of major significance to Marshall, to the state of West Virginia, and the Appalachian region. Earlier this morning, the National Institutes of Health and the University of Kentucky officially announced that NIH is making a 5-year, $20 million grant award to support research at UK's Center for Clinical and Translational Science, the CTSA. Through our CTSA partnership with the University of Kentucky, Marshall University has been awarded a $750,000 subcontract over the course of the next 5 years to fund scientists in our clinical research programs and to support training fellowships and early-stage clinical research and drug trials. The partnership with the University of Kentucky means that Marshall University and the state of West Virginia now are part of the National Institutes of Health's prestigious CTSA program, which is a national program, making both universities part of this select consortium of medical research institutions. This consortium is the gateway to future clinical research funding for the future of our nation. The strategic goals of the CTSA consortium generally are to accelerate, advance, and translate research discoveries in ways that lead to enhanced bedside patient care, treatment, and improved clinical outcomes. Inclusion in the 60-member national CTSA network of biomedical research institutions provides further validation of the quality of the scientific investigation being conducted here at Marshall and our commitment to provide better health care for the citizens of West Virginia and the entire Appalachian region. We are deeply honored to be part of this partnership and look forward to working with our other partners across not only Kentucky and West Virginia, but Ohio as well. This is a real milestone award for this university. John?
Well, I'd just like to say give you a few details about the award to echo what President Kopp was talking about. NIH laid out this vision 3 or 4 years ago in terms of trying to transform how basic research was taken into the clinic and was translated into favorable outcomes for patient health. They created this vision of a 60-institution consortium of clinical and translational institutes, and they positioned it to ultimately enable researchers to provide new treatments on a more timely and efficient basis more quickly for patients. This award builds on our existing relationships, which have already been well cemented through the medical school with the University of Kentucky and the other institutions such as the University of Cincinnati and Ohio State University, which are part of the Appalachian Translational Research Network. And I want to explain that in addition to the direct funding awarded through the subcontract, Marshall will benefit from access to the expertise and resources at University of Kentucky's Clinical and Translational Science Institute. That's quite a mouthful. And the opportunities to apply for significant research grants in the future, which are accessible only within the CTSA network. So we're in the club, and we're looking forward to that participation with great eagerness, because it offers an incredible opportunity to build capability in the clinical and translational research enterprise at Marshall, which will benefit not only our local hospitals, the VA, but the patient populations that we and the University of Kentucky serve. This grant is going to make a very real positive impact on healthcare for the citizens of West Virginia and the entire Appalachian community. It is focused on those health problems that are specific to Appalachia, and that dedication and focus is very real. Investigators in the national CTSA network are already working together to advance medical research, and we look forward to our participation in that effort. Researchers at the Joan C. Edwards Medical Center and Marshall Institute for Interdisciplinary Research will be involved in the project. The areas targeted for clinical research with UK and the collaboration include cancer, cardiovascular disease, diabetes, and obesity, the so-called Appalachian syndrome. And this is not the end, this is just the beginning. Yesterday, NIH just released the announcement of a new Institutional Development Award competition to allow states like West Virginia to further build clinical and translational research infrastructure. They require that collaborations with recipients of other clinical and translational research center awards is strongly encouraged, and we are hopeful that our collaboration and expertise and commitment demonstrated by our inclusion in this award we are announcing today will strengthen an application to this new opportunity in partnership with other institutions in West Virginia. So thank you very much. And we're hoping that this will all be part of a pattern of achievement for Marshall University that you'll see playing out over the next year. I mentioned that there were two visionaries in the room. It is also my pleasure now to introduce Dr. Charles McCown, whose commitment to clinical and translational research at the Joan C. Edwards School of Medicine has been undaunting and ferocious. We got a report in the Board of Governors today about a new clinical research facility that is nearing completion. So without further ado, I'd like to introduce Dr. Charles McCown.
Good afternoon, ladies and gentlemen. A very special day, to say quite the least. The announcement, in many ways, reflects a collaboration between University of Kentucky and Marshall. Certainly a collaboration that's mutually advantageous for the institutions, for the citizens they serve, for the pupils that they teach and train. This is something very futuristic, absolutely. I would like to point out that University of Kentucky and Marshall share a common rural Appalachian challenge for health. And actually, the challenge extends perhaps beyond our immediate eastern Kentucky and southern and southwestern West Virginia. But we do have interchangeable patient care areas. We also have mutual faculty appointments. I would like to point out that the largest, most comprehensive academic health center geographically close to us, there are others in our region, but the absolutely closest one is Kentucky. And they help us with our training and our surgical residence, transplant, and our general surgery, our orthopedic surgery, pediatric orthopedics, and what have you. I would like to point out some characteristics and be very brief in so doing. But 1 year ago, this very week, the USA Today announced the average ages of citizens of the various states in our country. In West Virginia, average age of our citizens is older than all states in the nation but two, and older than Florida. And just very recently, the announcement was now older than all but one, Vermont. That's interesting, and I think all of us here realize that the frequency of adult illnesses increases. virtually all illnesses increase with age. And in the areas that we're talking about now, that we're particularly concerned with, the Appalachian areas of Kentucky, Ohio, West Virginia, particularly for us, there's been an outmigration with lost economic opportunities, and the outmigration has been the more self-disciplined, energetic, and healthy people, so that proportionately, in those particular areas, in those particular regions, the bad health is beyond age factoring, and certainly this population is ideal for what we're looking for here, the futuristic, modern, and cutting-edge medicine. Translational research, I think we all understand it now, sounds very much like laboratory to bedside, but it is different. It's a little more, and particularly for us here, it means anywhere on the planet with discoveries and breakthroughs, and this means new drugs, new treatments, new procedures will be available for people to apply in a clinical utilization, implementation, again, whether it be surgery, medicine, studies, devices, or whatever. The very intense scrutiny that is inherent in this program is also desirable in that the scrutiny will absolutely authenticate the validity of the data, the data that we're acquiring, and also provide the utmost in patient safety. And I think that's something that we absolutely need. And also, as pointed out, there's a future here. These translational research sounds like it's immediate, acute, and this will only be short term. But the people involved, the physicians and the biomedical scientists, will develop skills and talents that are above and beyond those that could be acquired anywhere else, and they're in this region, so we're going to be looking at retention and distribution of these people in the future. And as a result, the overall impact of the CTSA will not only be rather immediate and in the immediate future, but will be long-lasting. Also mentioned, John pointed out that later this summer we'll have a ribbon cutting for something at the medical school site in conjunction with the Edwards Cancer Center, a Translational and Genomic Research Institute, the only one of its kind in the state. And also I need to point out long-standing our Center for Rural Health, which has extensive networking throughout the areas that we're going to be dealing with on the CTSA grant. I would also say that we've had long-standing rural health educational programs in the state that deal very closely and collegially with our good friends at the West Virginia School of Osteopathic Medicine and West Virginia University Health Science Center. We certainly plan to enroll them in participation for the CTSA grant. That said, I'm proud, honored, and privileged to be here today with you and let you know that this is a Herculean benchmark of progress in both medicine and health care.
Well, thank you very much, Charlie. An award of this magnitude, which is extremely competitive, could not have been achieved without the input of the folks who actually designed the science and wrote the proposal. And I would be remiss if we didn't take the opportunity at this point to recognize some of those folks. Dr. Dick Niles, who's the Dean of Research at the medical school, Eric Kmetsch, who's the director of the Marshall Institute for Interdisciplinary Research, is in the background. He participated with us and is actually going to be appointed a catalyst under the program, which is a nod to their mascot, I guess, but it's an individual whose job is not to just work within their institution, but across the entire collaboration to use their scientific expertise to pull out opportunities for new clinical and translational projects. So Eric, thank you very much for what you've done. And then Dr. Todd Gress at the medical school, who's the director of clinical research, was essential in building that bridge between the two clinical research enterprises. Looking forward, Jennifer Plymel from the Rural Health Center is going to be a very important cog in this machine, and we're looking forward to that team getting started here very shortly as we sign the subcontract with the University of Kentucky. So thank you all for what you've done. So I think that about concludes our announcement. It's very significant. It's a milestone for Marshall and the medical school. It is a very humbling opportunity in terms of what we have before us to address the significant health risks and health problems in Appalachia. And it is also a sort of a benchmark for the future, whereby this activity has prepared us to enter the next round of competition for the Idea Network CTSA Awards, which are going to be competed in August. So I thank you all for your attention. If you have any questions, everybody will be very available for interviews afterwards. Thanks a lot.